My name's Cassie Nobbs. I'm a physiotherapist at Comox Physiotherapy in beautiful British Columbia, Canada. My passion is helping people find healthy movement to improve their quality of life, whether that means gardening without pain or running a marathon. I hope you find these videos helpful. I am a physiotherapist, but I may not be your physiotherapist. If I am not your physiotherapist, do not do these exercises without consulting the appropriate healthcare professional before beginning, because you could hurt yourself. Let's start. Hi there, today's video is a little bit different. We're going to look at a self-mobilization technique for a stiff arthritic hip. What you'll need is some towels for padding out your hip joint, so that the belt that we're going to use, this belt right here, doesn't dig into your leg too much. A webbing belt works best. You can use a very strong TheraBand, if it was a TheraBand brand, resistance band, it would be like a dark blue or a black would work okay. And you may want to have a second belt of some sort or towel that you can use to help pull your knee across. You'll see what I mean by that in a minute. Last but not least, you need something very sturdy to be able to connect to and do the mobilization techniques with the belt. So in this instance, I'm going to be using my right leg as an example. So I'm going to get close to my sturdy object, maybe a heavy coffee table, maybe a bed frame, and I will loop this band around that object. I'm also going to loop it around my thigh. So I'm going to take the band, it's going to come up high around my right thigh, and before I try to do anything else, I'm going to take my towels, folded as they are to create a little bit of padding, and I'm going to put that really up high inside my groin area. So band goes like so, and then I'm going to move over such that the band has some good traction on it. There we go. All right. So if I'm too close to my object, my strap is going to be loose. You need to be far enough away that your strap is nice and tight. Okay, so now the knee is going to come up, and I'm going to pull the knee towards my opposite shoulder and release. Towards my opposite shoulder and release. And what we're doing here is we're very gently opening up that hip joint with a bit of traction on the joint. That's what the belt provides. This is the reason why it doesn't work when you just try to do it without the belt. The belt is what actually pulls the ball out of the socket just slightly, just enough to create a little bit of space and movement in there. Now, if you were really challenged and very stiff, you might not be able to grab onto your knee easily and keep your torso down. So you might want a second strap or towel or something that you can wrap around the leg and hold on to, and then you could use that to help with your pull, like so. So ideally, this is nice and rhythmic. Pull, release. Pull, release. And you would do this for anywhere from a couple minutes to maybe even 5 minutes. It feels quite good. So most of my patients that use this technique end up doing it for quite a long time, and 1 to 2 times per day. So that's a really effective way to mobilize your hip joint if you have a tight, stiff hip joint capsule from osteoarthritis or maybe from recent injury. I hope that helps.